the things in the times in which we live is a booster vaccine. What is the best booster vaccine? The world, though, has now hope because a new vaccine has come at fraction of the cost of existing vaccines. The COVID vaccine co-developed by Houston's Baylor College of Medicine, Hyderabad-based Biological E Limited, is patent-free COVID vaccine that can help with vaccinations in poorer nations. The vaccine, already approved by the Indian government, has placed an advanced order of 300 billion doses. Corbevax is being seen as the vaccine that could change the world's fight against COVID. Remember, India is also one of the countries that is likely to offer you a Corbevax vaccine. Well, joining me now from Houston is Peter Hotez. He is the scientist behind Corbevax. Appreciate your joining us, Dr. Hotez. You're the person who's brought out this game-changing vaccine. Before I come to that, what's gone so wrong with the United States where you are? A country at one point was clocking million infections a day, tsunami of cases. Before we come to your vaccine, what's gone wrong with the US, doctor?
Well, I think, what wrong is well before Omicron, in that we've got in the United States this terrible issue with vaccine hesitancy, vaccine defiance, very much along partisan lines, and that's now we're creeping up towards 850,000 deaths in the United States in this pandemic, and the last 250,000 did not have to happen because we had abundant vaccines available and people defied vaccines. It also meant that only 60% of the country is vaccinated when we should be at about 85% in order to slow transmission. So that was the first problem. I think the second problem is Omicron is far more transmissible than any other variant that we've seen. So even under the best of circumstances, a country would have problems managing that. And our big issue now is that Omicron is not necessarily a benign variant, as many people are saying. It is a serious pathogen. And we have a big level of absence now among healthcare professionals. So many hospitals, clinics now have so many cases among the healthcare professionals. They're at home, and this is now taxing the system enormous amounts. And because of this 1-2 punch of hospitalizations from the unvaccinated with COVID, together with a significant segment of the healthcare workforce knocked out at home with symptomatic illness. And so this is creating a very dangerous situation for the country right now.
Dr. Hotez, given this experience, can we therefore say that the only way forward is vaccination? Or should the world be looking now at other vaccine options? There are limited vaccines at the moment. Africa in particular, from where many of the new variants are coming, don't seem to have enough vaccines. Should we be looking at other vaccine options?
Well, I think, vaccines are front and center of a containment strategy, which of course includes masks, which also includes antiviral drugs. But front and center has to be vaccines. But the problem is this: we are seeing now declining effectiveness of some of the mRNA vaccines in terms of their durability of protection. And so what's unclear is whether this is something specific to the Omicron variant or whether this is a feature now of mRNA technology, because more or less mRNA is the exclusive vaccine used in the US, either from Pfizer, BioNTech, or Moderna. And whether or not that has the ability to give long-lasting protection or whether we need yet another vaccination strategy, that's a big question. But ultimately, vaccines are going to be the answer for the United States as well as for India.
Now, doctor, the world is at the moment talking about Corbevax as the vaccine that could change this fight against Omicron. One of the two new vaccines, it's also been added to India's COVID-19 vaccination program. The government of India says we will use it as a booster at some stage. We are waiting for it, emergency use authorization of Corbevax. As a co-developer of Corbevax, can you tell us how you believe it can help a country like India in the fight against the pandemic?
Well, I think it'll help in three ways. I think, first of all, as a standalone vaccine, it's looking like it gives fairly durable protection, standing up well against the variants like Delta and Beta. We do not have the Omicron-specific data yet, but it seems to be holding up better than some of the other vaccines in terms of other variants of concern. So I think, and it's relatively straightforward to scale. Biological E tells us that they'll be producing 100 million doses a month, up to 1.2 billion. So a significant percentage of the population of India could be vaccinated. Also, I think it has enormous potential as a booster. I think a heterologous booster with something like Corbevax might be preferential relative to, say, for instance, the AstraZeneca vaccine in terms of giving a more durable and higher level of protection. So I think that those studies are in progress. And finally, as a pediatric vaccine, since the technology uses is similar to that used for the hepatitis B vaccine that's been around in India for decades, that parents have been giving it to their kids for decades, and with the great safety profile, I'm hopeful this will turn out as a pediatric vaccine. Right now, the vaccine's been released for emergency use only as a standalone vaccine for adults, but hopefully in time we'll see some other uses as well.
Doctor, one final question to you, because what we are seeing in this country at the moment in the last month has been a sharp rise in COVID-19 cases, mainly due to Omicron. Mainly mild, but still pretty widespread. What is Corbevax's efficacy against the Omicron variant? If I take Corbevax as a booster, will it give me complete immunity?
Well, as I mentioned, Omicron, the Corbevax seems to be holding up quite well against the variants of concern, Delta and Beta, better than other vaccines. We do not yet have the data for Omicron, and we're working as fast as we can to get the Omicron pseudovirus and begin doing those tests. And so hopefully we'll have that data soon.
One final question. I think the world needs to congratulate you, Doctor, because you and your fellow scientists there have waived the patent on technology transfer, so Corbevax can be made available to the world. What was the thought behind this big decision?
The basis for not trying to patent restrict this vaccine or not providing strings attached is we wanted to make this vaccine freely available to any country, any low and middle income country vaccine developer who has the capacity to make it. I did not want patents to get in the way of this vaccine, or as I often like to say, when your house is on fire and you can only make one phone call, you don't call the lawyers, you call the fire department. And so this is the fire department, and we're not going to tie it up with frivolous patents and this kind of silliness. We need to vaccinate the world now.
Dr. Hotez, you've been, as I said, you've done a great service to all the world by putting out Corbevax there. It's one of the many vaccines that are involved in this fight against Omicron and COVID. But the fact that you waived the patent, I think, is extremely important. Thank you so much for joining me there from Houston on the News Today. On the News Today, as I said, we continue to take the fight against COVID seriously. News without the noise.